Today we're talking about the lumbar spine and lower back pain, as well some of the conditions that arise out of that. So in your lower back, you have a gentle curve that we should be seeing a gentle curve called the lordosis. You have bones and discs in between, the little shock absorbers in between. So you can have issues with the joints not moving properly, and that can cause pain. You can also have issues with the disc. So we see degenerative disc patients. We see patients that have bulging, herniated discs. People are sometimes confused because they don't know, there's these definitions, there's so many words around this. And obviously, even if you have a rupture of a disc, it is extremely painful. So, it definitely gets your attention. But it is shown a lot of times, even with an extrusion of a disc or a rupture of a disc, a lot of times that material can actually resorb and you can heal without drugs or surgery. It's just that it's really, it's a really painful thing to have to go through. So again, when we assess a patient, we see lots of disc and lumbar spine problems, probably because of sitting. I think that plays a large role into it. And obviously our active patients that are into a lot of different sports, there's a lot of sports-related issues to lower back. And the one technique I think that we use here at the practice that really stands out and shines is that Cox decompression. Not to just say that that's the fix-all, but man, it just really just shines, especially for those disc patients. It creates that pumping effect and actually creates some pulling back of the pressure against that nerve. And one of the things we don't often think about is that edema, that swelling that occurs in through there, and you need some, we just think of the mechanical pressure of like the disc or pressure off the nerve root. But what happens is when you have this pumping, you actually get circulation of these fluids and pulling some of that edema out of there, which relieves. It's like that nerve is being choked off. And so through this gentle pumping effect, it allows us to, through the course of care, maybe we'll do some different types of adjustments with the arthrostim or some traditional side posture adjustments later on down the road. But again, obviously very, very common. That's where you'll see a lot of your sciatica. It's actually not being pinched there is a piriformis syndrome, okay? But most common cause of sciatica, number one cause, is a pinched lumbar nerve root. Yeah, and so again, if you're suffering with something like that, please give us a call. That's one of the things we really shine at, and would be glad to help you out.